Tech is one of the major driving forces in the world today, as all sectors are making it an integral part of their daily activities. However, the gap between those who have full access to digital technologies and those who don't presents a barrier to the progress of digital literacy. Although definitions vary considerably, digital literacy generally refers to the information technology skills needed for the 21st century. Every sector in the country are imbibing the use of tech to enhance their operations and also to improve consumer experience. One sector that needs to improve the use of tech in Nigeria is the health sector. Healthcare providers should consider strategies to improve digital health literacy as the medical industry continues to integrate more patient engagement technologies. Joining us on the show this morning as we discuss ways to improve digital literacy in the health sector is Dr. Amenze Eguavoen, Programs Manager, Nigeria Solidarity Support Fund, and Joel Ogunsola, Technology Entrepreneur and CEO of Tech for Dev. Welcome to the morning show. Good morning.
Thank you very much. Good morning.
Good morning. Thank you for joining us. Quickly, your group is called the Nigeria Solidarity Support Fund. What is that group all about, and why digital literacy? But before you talk about digital literacy, maybe you talk about health literacy, which is really, in my view, the foundation.
Great. Thank you very much, and thank you for having me. So Nigeria Solidarity Support Fund is an NGO. We are a grant-making organization. We were founded through a partnership between NSIA, Nigeria Sovereign Investment Authority, and Global Citizens, a global NGO. And we were founded in response to the COVID-19 pandemic and its impact on Nigeria. And Nigeria Solidarity Support Fund gives out grants in support of interventions that can help governments respond to ultimately improve health outcomes for vulnerable Nigerians. So why digital literacy and digital health literacy? So we know that with COVID, the world has gone on to, everything happens digitally. And that was one major impact or something that came out from COVID. And if we do not catch up, then we're going to be left behind. Digital health literacy is the ability of the average Nigerian to pick up a phone, to access information, analyze information, and make health decisions that would help improve their health outcomes. So that's really important. We know that access to healthcare, quality healthcare, is not the best in Nigeria, and our health system is struggling. Digital literacy helps empower patients because then they can access information. So that's health promotion. It helps with universal health coverage. And that's something that we're struggling with and we're trying to achieve. So people can access information on their own. You can pick up a computer, you can pick up your phone, your tablets, whatever. With COVID, we saw how people received health promotion messages. You could even schedule appointments on your phone, online. So it increases demand for health services. I can keep going on.
Thank you. Thank you for highlighting that. I don't know if I have Joel. I know Joel is joining us virtually. Good morning, Joel.
Good morning.
All right, excellent. So Dr. Menze has laid a great foundation on the importance of digital literacy for responding to health challenges in Nigeria. And I'd like to ask you, what do you think are some of the challenges or greatest challenges to using tech as a solution to health challenges in Nigeria?
Thank you very much for the question. I'd say that one of the very first, obvious challenges would be the challenge of technology infrastructure. And when I say infrastructure, that would have to do with smartphone penetration as well as connectivity. So for a lot of people, connectivity is still quite expensive, regardless of what metric you're using to actually measure what the cost is of that. And beyond the expensiveness is then the availability across board. So the availability of high-speed internet across a lot of locations in Nigeria, is still quite a challenge, though rapidly improving. But as you move away from urban centers like Lagos, Abuja, Port Harcourt, and the likes, that continues to decline. And I'd say also, one major challenge will also be when you then look at the availability, the cost, penetration of smartphone devices, which is really also a function of the cost of smartphone devices. That's a major barrier considering the fact that a lot of people in Nigeria still live below the poverty line, which is why also you're then starting to see a lot of innovation around technology that focus on people who use future phones.
Right. Good to see you again, Joel. Okay, I'll come back to the studio and then probably I'll also throw a question to you. So why is this digital literacy important to you at the NSSF? That's going to be to you. But to Joel, the question will be, then how can we scale quickly since we know that technology affords us a lot of opportunities, since I know you're in the tech space, but you first.
Great. So digital literacy is important to us at NSF because we are trying to improve health outcomes for the average Nigerian. And like I said, it will help improve access to quality health services. If we think about it from the demand end and the supply side, with the demand side, we're talking about the average Nigerian, so patients being able to access information and make informed decisions about their health, which is important because then people can actually get the needed services earlier, and then we'll reduce issues on late presentations and untimely deaths. I mean, we have several issues, but it would help with that. On the supply end, we're talking about even capacity building for healthcare workers, right? Because then trainings can happen online. You don't have, which will cost less, because people don't have to gather together. People just get on their systems and take trainings. It helps with efficiency, helps improve productivity. Talk about telemedicine. As access to healthcare, we keep complaining about healthcare workers leaving the country. This is one way that technology can help improve quality of health services in Nigeria. Because now, a doctor anywhere, in fact, I heard recently about some country that for doctors who recently migrated, if you still have a practicing license in Nigeria, you can see patients while you're waiting to finalize your papers there, which is great because at least we will still have access to healthcare workers in Nigeria. So that's one great thing. With health information, your information with technology, information is right at the doctor's fingertips. Patients can access their own data. Doctors, other lab, pharmacy, especially when hospitals are interconnected. When you're referring patients, it's easy because you're not limited to what the doctor writes on the paper, right? So you move on to the next facility and all your information is right there. It helps with patient management because then the healthcare workers have all the information they need to make the right decision for the patients. Talk about even registration, vital statistics. When a baby is born, and the hospital right there and there, they can register. Mortalities are registered. So talk about national data will be improved through technology in healthcare. Logistic management, commodities, there's reduced wastage. There's less issues of, I went to the primary health center and there was a stock out of medication because the computer already tells you, it flags you when you need to order drugs. So all of those things add up to improving the quality of health services, right? So it's really important.
Okay, so Joel, how do we scale all of this? I'm sure there are many iterations. There should be some level of machine learning in this, artificial intelligence, and a potpourri of many things. How do we scale quickly on all of this? And is there sort of like any material on ground as regards app, engagement or anything?
Thanks a lot for the question. I think that, just picking up from where Aminze stopped, I think one of the biggest and most practical ways of, increasing access to healthcare through technology would be telemedicine. But then within that telemedicine bucket, I think we then need to look extensively as how do we extend the capabilities of telemedicine beyond smartphones, considering the fact that, especially if we're looking to impact a mass, population of people, considering the fact that a lot of people do not have access to smartphones, and that connectivity still remains a challenge. So we then need to start to think about, things like USSD extending, which has seen a lot of uptake within the financial services industry. So how do we extend same capabilities to allow people to be able to at least make inquiries, chat? In this case, it might be initially a bot that will power the USSD, and then with an opportunity to then transfer to an agent who could then, using a call center, technology, to then speak to that individual and make recommendations. Also considering the fact that there's also still, beyond digital literacy challenge, there's also a literacy challenge. Because a lot of technologies today are built using English, and that automatically excludes a good number of people within the suburban and rural communities. Being able to build also for capabilities for language support, whether through the USSD Futures, through the mobile app, or through call centers, essentially being able to directly reach out to patients would be an increasing part. So definitely, artificial intelligence, some bit of process automation would definitely come in, because, and Amazing spoke about, data, a national database, being able to make sense, because ultimately being able to make recommendations or being able to attend to patients would ultimately be a factor of the amount of data sets you have about that individual. So having systems that are able to pull data from different sets, from the pharmacy chains, seeing what, medications was last bought, to patient records and history, and being able to quickly, that turnaround time, I think will be very critical. And I think artificial intelligence, analytics, and a number of other things will be very integral to that progress we will see. But beyond that, we also need to continue to look at how do we increase affordability, or maybe some type of special intervention in terms of ensuring that people can get access to telemedicine or health solutions, maybe for free, for example, over certain network providers. Maybe network providers could, integrate that in some form of zero-rated service to ensure access to all.
Okay, this question is for both of you, but I'll start with you, Dr. Eguavoen. What should be the role of government in this, in facilitating collaboration between private sector and government, and also in ensuring health literacy? I ask you a question about health literacy. Before we begin to talk about, all this digital space and all of that, how about health literacy? What should government do?
Okay, thank you. So it's government's role to establish the framework, the strategies, the policies that would enable implementation. But beyond all of that, we actually have a current strategy for digital health, 2021 to 2025. But of course, it goes beyond that to actual implementation. And for that, we need to have all stakeholders at the table. We need to be able to pull the private sector together, because we know health resourcing is really poor in Nigeria, financing is poor. So we need to be able to leverage on the private sector pool, the civil society organizations for accountability. Everyone has a role to play, and it's the government's role to pull everyone together so we can all take responsibility and put in our 2 cents. Now, health literacy was your question. Health literacy, beyond the digital, so health literacy is still patients having access to information. It empowers patients, right? The more it's health promotion and health prevention, all of that information, being able to get. So you go into a health facility, patients should be educated. If we're talking at basic level we are, so you go into a facility, it is the responsibility of the hospital to educate patients on health issues, from preventive, health promotion, healthy lifestyle. Know how to eat, know how to exercise, know what you need to do, especially if you have existing conditions or family history of medical issues. So health literacy is empowering patients with the right information about their health so that they can analyze and make informed decisions to own their own health. I mean, there are also programs that help people with chronic health issues where you know how to take your, run your test every day. Say people with diabetes, you check your blood sugar every day, know when to take your med, tells you the importance of medication. So for government, again, it's still the policies, but we have the implementing partners, we have the private sector that can, we have media that plays a role in health promotion. So we all have a role to play, and it's really important that people understand health issues so that we can act promptly. Because one of the issues with healthcare in Nigeria is that we delay presentation. You wait until it's too late. You wait until you're almost dying before you walk into a health facility. When people are educated, then they know, oh, if my child has a fever above 38 degrees centigrade and I take my child to a hospital, I'm not going to be giving paracetamol or going to the chemist down the road. So health education is important, and then digital literacy can only help scale and improve access to health education.
Well, Joel, do you want to comment further on this issue about government and tech for health?
Thanks. I think that definitely, just piggybacking on what she said, policy support is extremely important. But I think beyond that, what we've seen, just like almost in a lot of sectors, is that there's a lot of actors and players, even from a government standpoint, multiple agencies, multiple arms of government from a regulatory standpoint and an intervention standpoint that are looking into different forms of health. I think there needs to be some, and a lot of effort that happen in silos, especially when I look at them from a technology standpoint. So the Ministry of Health has interventions going on, the HIV and AIDS Agency has interventions going on, and different technology stacks and solutions are being built to reach the same audience, but in silos. I think there needs to be an overall harmonization of these different technologies, especially as we continue to grow. And what that helps us to do is helps us then make sense of data. Data being gathered across multiple points are then able to improve the information and data we have on each patient and each individual. Ultimately, also from a regulatory standpoint, I think also partnering with or encouraging private sector players like the telcos and core infrastructure service providers, the fiber, connectivity providers, to then think about, especially from thinking about health from a socially standpoint, how can they provide, because there's a lot of work happening from an education standpoint with, connectivity service providers, providing free access to learning content and all that. How can we also replicate those same successes that have been recorded in some of those sectors as well in healthcare, ensuring that everyone through technology has access to quality healthcare?
All right. Thank you, Joel. Thank you. Thank you very much, Joel Ogunsola, Tech for Dev, and of course, Dr. Eguavoen, Nigerian Solidarity Support Fund.